Hey guys, in this video I will be covering the side effects that you can see with Montelukast. Montelukast is a medication, also goes by the brand name Singulair, that was used to treat allergic rhinitis and even asthma, but it's fallen off in favor, and we'll talk about why, because there is a very serious warning with this. So let's go ahead and hop right into it. So Montelukast is in a class of drugs where it goes in and it blocks what is called the leukotriene receptor. Now what that ends up doing is leukotrienes are involved in airway edema, where the airway constricts due to the edema. It's involved in smooth muscle contraction, and it's involved in the inflammation process. So the idea is by blocking these receptors, you'll benefit those things. But like all these videos where I cover side effects, what it does on one end of the body that can appear good, when you block certain things, it ends up causing potential problems down the road, and that is what we see. So you're going to see from the side effects with Montelukast that the numbers aren't really high, but they can be problematic. So first of all, people can develop a cough. Those are in roughly 3% of people according to studies. Some of these I see with higher numbers in the real world, but according to the studies, this is what we saw. We can see a fair number of skin infections and rashes. This is equal to or greater than 2% of people. You do want to keep an eye on liver enzymes with this. We can see liver enzymes go up. We can also see dizziness, fatigue, headache, and then lastly we have ear and respiratory infection. So we've got a couple of side effects that can be kind of respiratory infection related. Okay, now let's talk about the elephant in the room, which is a new black box. Well, not new, it's been around for a little bit now, but Montelukast used to be a lot more popular, but this black box warning was added by the FDA. And what we see with Montelukast is you can see an increase in neuropsychiatric events. What does that mean? We can see very serious things: increase in agitation, increase in aggression, depression, problems sleeping, and finally, and a huge one, is we have seen suicidal thoughts and even cases of suicide happen in people taking Montelukast, which is why it's now pretty much only reserved for extremely severe cases of allergic rhinitis that really haven't responded to other means. Then maybe we'll use Montelukast, but it's a drug that's fallen off out of favor with doctors, and that's the reason why. So let me know in the comments, have you taken Montelukast? How did you tolerate it? Experience any side effects? Those sorts of things. I ask you to do that because it's helpful for me to get your story, but it's also helpful for other people who watch this video. You know, they just want to hear other people's story and know what they're getting into if them and their doctor decide to move forward with something. So it's helpful all the way around to hear your comments. And speaking of which, I hope this video was helpful, and I'll see you in the next one, guys. Thank you.